Hello everyone, this is PHTV Channel 4 in Palos Heights. I'm Sue Jankowski. Welcome to Meet with Moraine. In this program we bring you once a month, we bring some interesting news and people that come to us from Moraine Valley Community College. So we hope you enjoyed today's program where we have Karen Kowalski, who is the coordinator of the Medical Assistant Program. Karen, thanks for being with us today.
Thank you for having me.
It's so nice. Now, I'm very excited about this because, you know, we all have experiences going to whatever health facility or hospital or something like that, and we're like, well, who are all these people working here? And it's good to know that there is a training that everyone can get, and that would be for this medical assistant program. So I guess, first of all, maybe you could explain to us what is a medical assistant? Like, what do they do?
Sure, I'd be happy to. So the medical assistant works alongside the doctor in the medical office, primarily in the outpatient clinics. So anytime that you would go into the doctor's office, routine appointment, specialty appointment, you know, the person who normally calls you back or takes your blood pressure, that would be a medical assistant.
Okay. Well, you know, I think it's so confusing nowadays. It used to be like the doctor and the nurse, and that was it. And now you're like, are you a nurse? Are you the doctor's assistant? What are you doing? So it is a medical assistant that's probably helping you in that first, before you're seeing the doctor or even a nurse. And that person does get some training to do that.
Yes.
Okay. So Moraine Valley is providing this kind of training. And that is so that these medical assistants can go to work primarily in outpatient clinics.
Yes, that's correct. Yes.
Do they work in hospitals too?
Some of them do. There are some jobs in the hospitals for them. You know, some of them might start out in those hospital clinics. They don't necessarily work on the floor as a nurse would, but they could work in with the doctors in the hospital. Some of them, we've had students who've come back and said, you know, we're working in the specialty area in the hospital. So there are some jobs for them in the hospitals as well.
Okay, so are they really more like the hands-on kind of people, or do they do some of the written work? You know, there's so much that needs to go in computers nowadays. Do they do that as well? They
are trained to do that as well. It depends on the doctor's office. There are some smaller offices that may have medical assistants working at the front desk, working with the coding and billing, which is how insurance companies get their payment, how we notify insurance companies about payments. And then we have medical assistants that are also doing just the primary hands-on work. So if you've ever needed to get a strep test, or if you've ever needed to have some specialty testing done, the medical assistants are trained to do that as well.
Really? Okay, so that really does take some education, because some of those are really kind of a little bit tricky, especially with strep test type things. So, okay, so now it's offered at Moraine Valley Community College that they can get the certification to do this. How long is this program, and what does it entail? What do they do to learn to do this?
So the program is approximately 2 years long, depending on how quickly students want to go through it.
Okay.
If the students do have their prerequisites done, that would be like your medical terminology courses, your anatomy and physiology courses, then they can start a little bit faster. So the program, for our program, primarily there are 6 courses the students need to take, plus an externship and a seminar, which is done at the end of the program. And the externship and seminar gives them 160 hours in the clinical setting to practice everything that they've learned through our program.
Wait, I've never heard of an externship. That's not an internship. What's the difference between those?
So the externship is an unpaid position in a clinic that is one of our affiliates.
Okay.
So we use affiliates, you know, the bigger name medical systems in the area, smaller doctors' offices. So students would go into the setting for approximately 4 to 5 weeks as an unpaid extern.
Okay. So they're getting that hands-on experience right then.
Mm-hmm.
Okay, so they take the classes, it's 6 courses, then they do an unpaid externship for 4 or 5 weeks, and then what was the next thing they did?
Well, then once they've completed their externship and their seminar is a class where they meet with us and we help to prepare them for their certification exam. Then they would take the certification exam and they would become medical assistants.
Okay, so I mean, really, when you go out looking for a job, I want to say that years ago, probably people just went and we're kind of trained at the doctor's office to do this. I think it's kind of reassuring now that there's a actual procedure to go through, so that you do have those skills, and having that externship gives you the hands-on, which I think they're probably more comfortable with that, because when they go in for a job, they've had some experience, even though it would be limited. So this sounds like a really great program.
It is a wonderful program. We're well known in the area, and employers do seek us out when they're looking for staff members. Now,
is this like pretty full all the time? Are there a lot of people going into medical, becoming a medical assistant?
We could always use more students. We have a great need for medical assistants. The program, it runs throughout the year, and we do occasionally have open classes, so we welcome anybody who's interested in the program.
Okay. I'm wondering too, with the population of the country, getting older, and there's this big group that is getting older, and there's all these senior living type places. Would there be a niche there for medical assistants in that type of environment?
It's a possibility. That's more of a CNA type of position, but depending on whether the place might need somebody to do those specialty tests or assist a doctor while they're making rounds, there could potentially be a need for that. But at this time, it's primarily CNA work.
Okay. So that brings us to those of us who maybe, we don't know. What is the difference then? Here's a medical assistant, here's a CNA, and then I know a nurse and RN gets a 4-year degree. That's different, and have more medical training.
Absolutely.
But what is the difference then between a CNA and a medical assistant? What kind of training differences do they have?
Well, the CNA, their training is approximately 6 weeks. I know at Moraine that's what our program is. And they also do clinicals. They go to the nursing homes and work with the patients there. But the CNA does not have as much specialty training as the medical assistant would. The medical assistant has training in performing EKGs on patients to check the heart. They have training in respiratory treatments and things like that. The CNA doesn't have that much training. They do train on how to take vital signs, blood pressures, pulses, respiratory rates, and how to assist patients in the inpatient nursing home setting. But they don't have the specialty training that the medical assistant does for the outpatient setting.
Okay. Well, that's really good to know. So, let's see. When I was growing up, there was something called an LPN. No, there's no such thing as that. That's a CNA.
There is still an LPN.
There is.
An LPN is a nurse who would have to go through more training to be able to administer medications. And so an LPN can become a registered nurse with a little bit more schooling.
Okay. So there's a lot of varying degrees because there's so many different needs.
Right.
So really for a medical assistant, I would think that the job opportunity would be pretty great.
Oh, it's wonderful.
And I would think that their salary, their pay or whatever would be commensurate with that need for that. I would think that might be a good career path for a lot of people.
It definitely is. Yeah, it's a wonderful career working with patients. If you want, you can work in pediatrics, work with the little people, work in specialties, orthopedics, all kinds of different specialties. And some people use it as a career, and some people use it as a stepping stone if they choose to go into other careers. We had a student who went into medical school. So it's a very flexible type of certification.
You get some of those needed things. Also, I think with this too, you might think, well, am I someone who's interested in the medical field? This is a great way to get started in the medical field, because sometimes you're like, well, maybe that really wasn't for me, or maybe, just like you said, sometimes people go on to, get their RN or do other things. So with this medical assistant, that's completely different than becoming a phlebotomist or getting into radiology and stuff. This is a whole other niche for people.
It is.
Okay.
We do work closely with phlebotomy. students. Our students do have to go through a phlebotomy course in order to be familiar with what a phlebotomist does, but it is very different from like a radiology technician or respiratory therapist that you might see in the hospital.
Okay, so they, they might decide to do that too eventually.
Absolutely.
At least you have this. It would seem like almost this too. I mean, young people, that's great too. But it almost seems like a lot of times this could be like almost like a second career for people. Where they're like, well, I did this. I'm now in my 40s or 50s, whatever, and I'd like to try something else, or I'm interested in this. Do you see a lot of that?
Absolutely. We see everything. We see recent high school graduates, and we do see, second careers.
Second careers, yeah, that's what I would think too. Is this kind of an open, like it's male and female? In the past, this kind of thing kind of lent itself to more female, but now, you see a lot of male nurses, which you never did before.
Yes.
So this would be like that as well.
Absolutely. Male and female, absolutely.
Everybody.
Yep, everybody. Come on in.
All ages, everybody, just come on and be a medical assistant.
We'd love to have you.
So, to get into the program, and you're going to devote 2 years to this, what should they do to do that? How do they get started?
Well, they would need to apply at Moraine. And once they are accepted into Moraine, they go through their placement testing. They can start taking classes. We do have some prerequisites that they need to take. They could start taking those, and you don't need to apply to the program. There's no special process. But once you're accepted at Moraine, you can become a student and the medical assistant. If they have any questions, they can certainly find us the most recent information on the Moraine website, and they can take it from there.
Okay. I think the other really great thing about this is at the end of 2 years, you have a career path.
Yes.
It doesn't take you. So if you're 18, 20 years old, you already have a career path that you can get started
Absolutely.
on and make a nice salary and go off on your own. Or if you're somebody who, I always think about people too who maybe, I don't know, they started at 18, 19 and then they did something and they didn't want to do it anymore. It used to be where there were some women who were home with kids and, now they can do something else and this would be a great starter for them.
Absolutely.
So this is full-time though that they're working, they're at school kind of as a full-time student.
If they want to get it done in 2 years. We certainly welcome students who want to take it part-time. We do offer some evening classes. So, if there is somebody who's looking for a second career, has other commitments at home, we are students are able to go through it part-time as well.
Oh, that's good. Because sometimes, people's lives get kind of busy and
we understand.
They want to take it. And that's the other great thing that we keep bringing out about going to Moraine Valley Community College is that they'll really kind of work with you as far as classes, courses. They want you to be successful. It's very reasonable, so you're spending your money in a way that's going to pay off for you, and you're not going to have like this gigantic amount of debt afterwards, which
Absolutely.
I think is a huge plus to the school. And they're willing to work with you for your career. So now we're in December right now, so we're starting a new semester in January.
Yes.
So, it's probably a little bit late to start right now, but if you're interested in the summer session or spring session, can people kind of jump in then?
Sure.
Or is this just more like start in the fall?
Absolutely. They can jump into some of the prerequisites, and then in the fall they can start with the medical assisting courses.
Okay. So if you're thinking about that, just get started, contact them, and they would just go on the website.
Yes.
And look for a medical assistant there.
Yes.
And then just click away. And, sometimes people want to talk to someone. You can go in to make an appointment and go in and talk to
Absolutely.
someone. Help guide you through that whole process.
Absolutely.
Karen, do we get to everything? I want to make sure that people know all about this medical assistant program because I think it sounds really great.
I believe we did pretty much get to everything.
Okay.
It's a great program, and we're highly sought after. So, we would welcome anybody who has any questions. I'm there. I'm the program coordinator, so I'm there full time, and would be happy to answer.
Okay. So if you're looking for something that you get to work with people and you get to help people and you get a good career on top of it, contact Moraine Valley and they'll help you out. Or maybe you have some other ideas about what you want to do. Moraine Valley has all those answers for you too. So, Karen, thanks for being here with us today.
Thank you for having me.
It's a pleasure, and I hope you enjoyed watching our show today. We'll see you next month on Meet with Moraine. Bye now.